Hello everyone. So today we will be talking about the knee joint as well as the tibiofibular joints, which contains the proximal and the distal parts. So we'll be talking about three parts. So first of all, let's start with the knee joint. The knee joint. In terms of the landmarks we can find on the tibia and the fibula, let's start with the tibia. So the tibia landmarks. Tibia is the primary bone which is located medially, and the fibula is the one that's laterally. So, in terms of the landmarks, we can have uh, this is the proximal part. So we have here intercondylar eminence. This is the intercondylar eminence, and then we have the medial and lateral condyle. Right, these parts, and after that we're gonna have here the tibial tuberosity, and here we're gonna have the fibular notch where the fibula will attach here. Okay, and what else can we have in this part? We can also have a line which is called the Soleil line. Yeah, pretty much that's all. And lastly, in the Soleil line, and also distally, we can have this. This is called the medial malleolus. Double M malleolus, right? So the medial malleolus, and also we'll be working with the lateral malleolus of the fibula. So here in the fibula, we're gonna have lateral malleolus, and this will have mortise joint. So together they will form what is called as we call this as a mortise joint, because in short it looks like this. So the talus will be here, and all of that we'll call as mortise joint. This is something we call in the wood type of joints. Okay, it's an interlocking joint which contains the talus in between, right? And in terms of the fibula, so all of this 1 2 3 4 5 6 intercondylar eminence, medial lateral condyle, tibial tuberosity, and the fibular notch, soleil line, and the medial and lateral malleolus. However, we're going to have the fibula. The fibula contains not too much of landmarks, but it was noticing. So we're going to have here the fibula. The fibula has the apex of the head. This is the apex of the head. We're going to have the head and the neck. We can also have the lateral malleolus, And in both of these, we're gonna have interosseous crest, where the interosseous membrane will be joining these two. All right, that's all for the landmarks. Also for the joint, we're gonna have the fibular, the femoral condyles. So these are the tibial condyles and the femoral condyles, right? So in terms of the joints, there are three joints. Let's do this part first. The joints, there are three joints. This one, and that one, and this one. Oh, we can also have three in between. So here we have modified hinge joint. Why is it called modified? Because in flexed knee position, we can have rotation. So try to flex your leg and rotate it medially and laterally. This will happen. So that's why we call it modified. But it's not a primary movement of the hinge joint because it only makes flexion and extension. For the second, we have the proximal tibiofibular joint and distal tibiofibular joint. Here it's very strong. So it's syndesmosis here. Distal. So distally it is syndesmosis. Distal with the D, it's syndesmosis. So the distal tibiofibular, it's syndesmosis, but the proximal is the plain synovial. And you know the interosseous in between, which is usually the interosseous is always syndesmosis as well. So we have syndesmosis, and plain, right? So we can say, this is also syndesmosis. So syndesmosis, distally and in the interosseous membrane, and plain in the proximal part. So there's just going to be sliding and gliding. The hinge, modified hinge joint, flexion, extension, with a little of rotation in the flexed knee position. When it comes to the ligaments that support this joint, so in the knee joint, we're gonna have 6 sets. Knee 6. This is the knee. So just make 6 out of it. So in the knee there are 6 sets. I'll make them as, alright. Firstly, we're gonna have one which is here and one which is here, which connect the patella. So here, firstly, the quadriceps femoris tendon, and here the patellar ligament. Oh, actually these both in one set. Ligament. The second set, which is here, we're gonna have, what is it called? Retinaculum. Yes, retinaculum, medial and lateral retinaculum. So there are two things: the retinaculum. So there is the medial and lateral retinaculum. Retinaculum. How can you remember this? retina, it's the eye, isn't it? Yeah, retina is from the eye. So just remember this as an eye. This is an eye. So retina from the eye, retinaculum. And next we're gonna have the medial and lateral collateral ligament, which is here. Collateral ligaments. What else can we have? We can have the anterior and posterior cruciate ligament. Cruciate ligament. So it's called anterior and posterior. This is the part where the ligaments start to attach in the tibia. So the anterior cruciate ligaments attach in the anterior part of the tibia and prevent the tibia from having anterior transition. The posterior cruciate ligament will attach at the posterior part of the tibia and prevent posterior transition of the tibia. Okay, so from that part you can have the tibial attachment and the tibial prevented transition. Okay, the last two, which there is one which is found at the back. There is the oblique and the arcuate popliteal ligament. The oblique will be looking like this. The arcuate will be looking like this. Exactly. So this is the oblique with the in and the arcuate bonus. So this is the medial condyle of the femur and the oblique popliteal ligament and the arcuate popliteal ligament. Okay. What else can we have? 1, 2, 3, 4, 5. The last set which can be found is the meniscus, the medial and lateral. So there are actually 3 medial and lateral. Medial and lateral meniscus. The medial and lateral meniscus. By the way, the anterior part is the one that it's more prone to injuries, and the medial meniscus is the one that it's more prone to injuries. And it acts like a crush, like something that hold this. So here they're gonna have like a cushioning between the two bones. So we have 6 sets: medial, lateral retinaculum, medial and lateral collateral, medial and lateral meniscus. We have the quadriceps femoris and the patellar ligament, which are in the superior and inferior part of the patella, and the oblique and arcuate line and the cruciate ligaments. We have 6 sets of ligaments, 12 in total to support this knee. For the proximal and the distal part, we're gonna have a little types of ligaments. They're not so much, but it's worth noting. So we're gonna have posterior in the posterior part, posterior superior tibiofibular ligament. tibiofibular. So we're gonna have in the posterior part. Let's make it with another color. So we're gonna have posterior, superior, tibiofibular ligament, and the joint capsule. This is in the distal part, and the proximal. Sorry. For the distal part, we're gonna have the anterior, inferior, and also the interosseous membrane. That's all. And thank you so much. That was all for the knee joint. And now we have finished this part and this part, talking about the landmarks, the bony landmarks, the ligaments, and the joint types. Thank you.